For our newsmaker, and we're joined by Dr. Madhukar Rapai, epidemiologist and director at the McGill International TB Center in Canada, to talk about how Canada has dealt with the pandemic so far, as well as what are the challenges he sees going forward. Thank you so much, Dr. Pai, for joining us. So do tell us, how has Canada dealt with the COVID pandemic? Are they doing extensive testing?
Firstly, I think among the richer countries, Canada has done well. Perhaps not as well as, say, Australia, New Zealand, for example, but certainly in comparison to our southern neighbor, United States, Canada has done really well. As of now, we have about 130,000 COVID cases confirmed, about 9,000 deaths. So although the number of deaths are not large in absolute numbers, it turns out to be almost 7% of all those who developed COVID. Now, 7% is quite a high death rate. And the reason where I think Canada did not do well in controlling deaths is because Canada has a large number of elderly people, people 70, 80 plus, and 80% of all deaths in COVID deaths in Canada have occurred in the elderly long-term care facility homes, what we would call nursing homes or residential homes where old people live. That's where the epidemic absolutely ravaged Canada and left a large number of residential home facilities compromised. And it really exposed a very negative part of how elderly people were being managed in Canada. And I hope it will lead to some reforms in how we protect our elderly. So I think that is one area where Canada gets a very poor score. In terms of tests done, the testing rate is not too bad, is about 147,000 per million population. But all of us here in Canada wish testing was much more easier to access than what it has been. It has still been a bottleneck. I think in every country in the world, testing has been a bottleneck. And the same thing is true for Canada. We've done better than in the past. But even now, for example, our child has started going to school, and nobody in the schools are being tested right now. So we don't even know at entry into the school year what proportion of our children are infected or positive. We just don't know. So testing is still a bottleneck, I would say.
And now it has been 8, 9 months of dealing with this pandemic. What do you see the challenges going forward? The seasons are changing. As you mentioned, schools are reopening.
I think in here at least, in many countries, in North America, for example, we're really worried as our children have just started going back to school. So many months they've been at home. In some ways, they're protected. Now they are out of the bubble. They are starting to get together in big numbers. Yes, the schools are trying to reduce congregation. They are asking for children to be masked above a certain age. They're using hand sanitizers and all that. But we just don't know how long this is sustainable. Children are children. It's very hard for them to not engage with their fellow classmates that they're missing for a long time. And then when the economy opens up, and we've learned by now that when you open up bars, for example, bars, restaurants, nightclubs, karaoke bars, suddenly you see a massive increase in cases. So, we're learning that there are some areas which are really high risk for transmission. And then the minute you open up, cases start surging. We also worried about fatigue, right? Everybody is fatigued. It's very hard to ask people to mask endlessly for month after month after month. And how long can young people not see or mix with others? How long do you not have sports and other social activities? The appearance of the flu pandemic, which is expected very soon here, is another concern because flu is something we worry about every single year in fall and winter. And now you have a twin pandemic situation where you have the flu, whatever the virus strain that is going to come around this year, plus you have COVID-19, and nobody quite knows how this twin epidemics will pan out and play out. And then lastly, I think even as we anticipate a COVID vaccine, the anti-vaccine sentiments here, at least in North America, is
Yes.
starting to really peak. And it's very stressful to see that, because even if we had a good vaccine, and if a large proportion of the population is very skeptical or hesitant, then how do we accumulate enough herd immunity with the vaccination to protect the whole world? Because with vaccination, it's not just about us, right? We are also protecting others. And if sufficient proportion of the population declines the vaccine, then I think we are really headed for a very bad situation. So just because there's going to be a vaccine, I hope, doesn't mean the battle is won. Getting people to take it would be an equally important struggle, I think.
Absolutely. And what are your concerns regarding this reinfection issue, which everyone is talking about? There have been, a case reported in Hong Kong, some in Europe. We have anecdotal cases here in India as well.
I mean, if we've had 25 plus million COVID cases globally, and we're only hearing a few reports, then as an epidemiologist, I would say these are relatively rare occurrences, right? If it was a massive problem, we would have learned it by now. The fact is, out of the 25 million, most people have recovered and have done well, should actually give us hope that this reinfection is not a massive issue. Even if it is, the way most infectious diseases work is the first infection, we take time to build up our antibodies against it, right? The second infection, even if we get infected, the viruses can be very easily eliminated because the body has a memory, right? There's an immune memory that makes it easier to knock off the virus in the second round, which is why we do give a booster dose for many vaccines, because we're trying, the first infection is like priming, the second is the boost. So it might well be possible that we might get exposed to the virus after we recover, because the pandemic has not gone away. But our ability to tackle the second virus would be much better, since we have memory of the first immune response that we had. Even if the antibody levels wane over a period of time, we will still should be able to deal with the virus better on the second round, because the body will remember and mount a better response. So most virologists and public health people are not too concerned about reinfection at this time, because I think we all think the second infection will be handled better than the first one.
And finally, I have to ask you, what would you say about how India has handled the pandemic so far in the situation that we're seeing now with cases increasing every day?
Of course, I worry about India every minute. My family is still in India, everything, all my research is in India. So I do worry a lot. And the spread to rural areas is absolutely terrifying. The problem with India, as you know, Gargi, is that our health system was quite fragile even before the pandemic, right? And that's why our public health infrastructure was never great. India continued to underinvest in health as a percentage of the GDP for decades and decades. So in a crisis, the public health is just drowning in COVID, while the private health system, which we all thought was the solution, has had its own challenges. Cost of care has gone up. People are running from hospital to hospital looking for private sector care. And it's very challenging for someone in India, because they're stuck between underfunded public system and a potentially exploitative private health system, which I think is a huge concern for India. Now, in rural area, private health sector is what? You don't even have private hospitals in many rural areas. What you have are government PHCs and CHCs, and you have the informal providers, what we call alternative healers, Ayush practitioners, unqualified practitioners. They are the backbone of India's health system. In fact, 70% of rural primary care is informal health sector. Now, how does an informal provider deal with COVID-19? I can't even understand where that capacity will come from. Where are the ICUs? Where are the ventilators? How are people who are really sick going to survive this? So my hunch says, and I hope I'm wrong, that the mortality rate for COVID in rural areas has to be higher, just because you don't have access to high quality medical care. And that is, I think, a huge concern. And then I'm also very concerned that everybody is so tunnel visioned about COVID that we have dropped the ball on everything else. What about routine immunization? What about maternal and child health? What happens to tuberculosis? What happens to people with malaria or cancer or diabetes? By only focusing on COVID, we haven't done enough to resume normal routine healthcare services, so that mortality is lowered, because death rate in India is not just COVID, right? People are dying of untreated diabetes or untreated TB We must get a handle on it, and we must resume routine essential health services in every place, rural and urban.
All right, very important point there, Dr. Pai. Thank you so much for speaking to us at NDTV.